Namaskar parents, I am Dr. Dipesh Prajapati, dentist just for kids from Jaipur, Rajasthan country, India. In this video, let's talk about what special consideration we need to take with kids who are diagnosed with cerebral palsy. First and foremost thing is I would to tell parents that if your child has been diagnosed with cerebral palsy, these kids are often on only soft diet and often we add sugar to make it more palatable for the cerebral palsy kid. These kids are very prone to dental problems and perio problems and gums problem, and please do not wait for some problem to set in to visit your pediatric dentist. Please take your child for preventive dental visits before any major dental problem sets in, because these kids have limited cooperative ability, and if some major dental problem happens with them, we have to put them to general anesthesia, which increases the risk and cost of the treatment as well. Cerebral palsy kids, as we all know, are a little spastic and they cannot move their hands and leg like normal kids, and they want to be comfortable in a particular spastic position. So you need to carry some pillows, cushions or something like that to be put on the dental chair, so to make them comfortable, and if they sit easily on the dental chair, they are more cooperation while dental examination is expected. Brushing these kids is always a nightmare for parents, but please understand that we have to win this war. We have to crack the code how to brush for your cerebral palsy kid. You need to consult your pediatric dentist and consult that what are the best ways, positions, brush, everything to brush their kid. Not brushing is not an option for a cerebral palsy kid, because as I said, they are more prone to caries. We have to brush probably after every meal for a cerebral palsy kid to prevent dental problems. These cerebral palsy kids also have medical issues like seizures. We need to consult the pediatric neurologist before taking the child for any major dental treatment, because we need to cover it up and we cannot afford a seizure getting precipitated on the dental chair for a cerebral palsy kid. Regarding the scheduling of the dental appointment, cerebral palsy kids often are very active and more attentive during the morning hours, so you can request your pediatric dentist to give the first slot in the morning. And added advantage is the dental team is also very fresh and they can be more patient and give more energy towards the special child. Cerebral palsy kids often are bruxers. They often grind their own teeth, and that complicates the dental treatment as well. They sometimes one of the crowns also which we give for these kids. So what we can do as a preventive thing is we can make them night guards. We can make them soft plates which they can wear on the teeth, and if in case they are grinding, the damage is on the plate, not on the teeth. And often I have observed that when we give such night guards, the grinding reduces as well. Cerebral palsy kids also have very high gag reflex. They often suffer from something called as gastric esophageal reflux disease. They are hypergaggers. So I always recommend my cerebral palsy kids parents to bring the child empty stomach at least by 2 hours, so that whenever I am doing the dental checkup, they do not gag and vomit on the dental chair, making it difficult for the child and making them uncooperative for that appointment. You also have to understand that if you are planning any dental treatment which is not under general anesthesia, the treatment might go very slow. The treatment might take a lot of time, more number of appointments as compared to other kids. So you have to be very patient with the dental appointment, the number of sittings the dentist is calling you for doing the required treatment. Cerebral palsy kids, because of their spasticity, because of their seizures, often fall and break their teeth also. I recommend whichever day the child has fallen and hit his teeth, please take the dentist on the very same day. Do not wait for some pain or swelling to come, because again, if we can treat the dental trauma in early stages, often the treatment is very easy and can be done on dental chair. But if pain sets in, again we will have to subject the child for general anesthesia, which will increase the risk and your treatment cost also. One last important thing which parents should take care is, because of the hypotonicity of their muscles, cerebral palsy kids often pouch their food in the cheeks. If the child is pouching the food in the cheek, please make sure you use your finger to clean the buccal sulcus, the space around the teeth, so that the food doesn't stays long in the mouth, because if the food stays long in the mouth, it will cause cavities and again create problem for the child. If you have doubt on the same topic which we have discussed in this video, you can drop your doubt or your question in the comment section below or on the email ID given above. I will definitely reply and try to help. Dhanyavad.